One. Hello and welcome to Shriners Hospitals for Children. My name is Tammy Robbins and I am here today with Dr. Mark Miller, who does a lot of Clubfoot treatment in our patients here at Shriners Hospitals. Dr. Miller, welcome today.
Thank you, Tammy. Thank you for having me, and thanks to all who are joining and kind of watching this. I look forward to this.
This can be a good discussion. Dr. Miller, who is also assistant professor of orthopedic surgery at Washington University School of Medicine, treats children with upper and lower extremity trauma, hip conditions, leg length differences and deformities, such as an angle or rotation of the child's leg, pediatric foot disorders, clubfoot, and flatfoot. We are lucky to have you as a surgeon for our Shriners Hospitals patients, Dr. Miller. Would you mind telling us a little bit about why you became a doctor and what drew you to taking care of children with orthopedic conditions?
For sure. Thank you. And I'm lucky to be able to take care of Shriners patients. It's a really unique place. So why I became a doctor? So I grew up with my mother kind of out in the state of Washington. She was a nurse. And so I spent a lot of time around the hospital, like after school. So I kind of knew a lot of the doctors in town, and I kind of knew early on that that's what I wanted to do. And, after college, I was able to go to medical school. Kind of my two favorite parts of medical school was anatomy, particularly anatomy of the arms and legs, the extremities. So orthopedics was kind of a clear choice for me. I also really enjoyed my pediatrics rotation. And so I enjoyed taking care of kids and just, enjoyed the interaction between the parents, the child, and the physician. And then during residency in Seattle, that's where I kind of fomented my love of pediatric orthopedics, watching the growing skeleton. And it's really just a pleasure to be able to take care of children and their families.
That's outstanding. So, it's always interesting for us to hear, how our physicians came to be interested in what it is that they're doing. But now I'd like to switch gears and talk a little bit about why Clubfoot. Actually, before we talk about Clubfoot treatment, I have one more question for you. And that is, I just want to have a little bit of fun. All of us who are here as a part of Shriners Hospital, and you mentioned this earlier, that you're lucky and blessed to be part of Shriners Hospital. We all have a special place in our hearts for it. Tell us a little bit about why Shriners is a special place for you and what you love about it.
Well, what I love most is kind of the team atmosphere, particularly in clinic, where it's not just me as the physician taking care of the family. It's everyone who's involved, from our physical therapists, who play an important role in both operative and non-operative care of my patients, as well as our clinic nurses and care managers who kind of help coordinate care, and also are kind of the lifeline for families when they're away from the hospital, as well as our CAS technicians, medical assistants who help kind of the clinic flow and help me take care of patients in clinic. I think just the whole team atmosphere makes this place special.
That is different than many other places, isn't it? And I think that's something we talk about that a lot, and I think we take that for granted here.
And then sometimes maybe the visits are longer because you're seeing the physical therapist, you're seeing the orthotist who's right next door, and the communication you get to have with them is on that same day is important. So make sure we're all on the same page. If it's not all in the same place, sometimes there can be things lost in translation. But if it's all kind of here in house and we all work together, I thought that's a better care model.
Yeah. Talk a little bit about the kids and the families that you get to meet.
Yeah, so we kind of families from all over, of varying ages, from brand new babies, even actually some prenatal consults where a mother has, a child diagnosed with clubfoot or fibrohemia or limb deficiency, they can come in for a visit even before the child is born, to kind of up 18, 19, 20, 21. So the wide range of children. They're from all over the Midwest, from certainly on our local Missouri, Illinois families, also families from Indiana, Kansas, Nebraska, Oklahoma, Arkansas. And there's other states that we see, but all their region.
Yeah, I bet you're glad to see them when they come in.
Oh, for sure.
Okay, so thank you for sharing that with us. And I'm sorry, I'm not a professional interviewer, so I have to check my notes here. But we want to talk a little bit about clubfoot treatment. What does a new parent or a new parent to be, because you said that some folks get this diagnosis before baby's even born, what do they need to know about a diagnosis of clubfoot for their baby?
Yeah. So again, what a clubfoot is, it's It's a foot difference. There's kind of four parts that we look at that are kind of different in a club foot. First, there's something called cavus, or kind of high archness of the foot. There's hindfoot varus, or the heel is kind of turned inwards. Forefoot varus, where the forefoot is pushed, is kind of turned in. And then hindfoot equinus, or ankle equinus, where the ankle is contracted downward and the Achilles tendon is tight. And so for us to diagnose a clubfoot, all four of those have to be present. There are some cousins to a clubfoot, most notably metatarsus adductus, which just has the forefoot turning in, but doesn't have the other parts. And so it's important when we kind of see the child that we kind of make the diagnosis of clubfoot first. And that certainly the clubfoot is a condition that we can treat, and we treat here at Shriners. And it's the goal for us is to have the most function possible. And that most kids, when they kind of hit their 8, 9, 10, 11 teenage years, run, play sports. And the goal is to have them be as functional as you can. And many times you can't even tell by the point that they have a clubfoot because the kids don't let it get in their way.
That's great. Well, kids are so resilient, you know.
And that's why it's a pleasure to work with children. They always want to get better, and they can overcome challenges.
Do they whine as much about physical therapy as adults do?
Yeah, I could encourage families. So at least when kids are younger, we actually don't do, we have our physical therapists kind of show the families in the stretching. And we actually can encourage the family to do a lot of that stretching, and becomes almost part of the kid's routine. And certainly there are challenges with that, with kind of the family dynamic of stretching. But I think it's actually probably the most important part of our treatment in preventing recurrence of a clubfoot is kind of the parent's hand on the child's foot, working to kind of keep its flexibility.
I did skip over a little bit there. I was just, knowing the resilience of kids, and, sometimes it's tough for them to do physical therapy, but I think adults, have a more tough reaction to it. Can you describe some of the different treatments that you and the team there have available for children who have clubfoot? What are the options?
So really the gold standard of treatment for all club feet, regardless of type. So the most common type is idiopathic clubfoot. That's where we don't have a reason that it's child just born with it. Then there's also neurologic clubfoot that's related to the spina bifida or arthrogryposis. And also regardless of age of treatment, whether they're brand new baby or they're from a foreign country, a 13-year-old, we all start with something called the Ponseti method of treatment. So Dr. Ponseti was a orthopedic surgeon in Iowa and developed a casting technique that we all use today. And so casting was actually, even before Dr. Ponseti, there was something called the kite method of casting, where you kind of turn the foot in and down, and it ended up with all the children who had the kite method, and this was kind of 50s, 60s, 70s, ended up having a very high arched, non-functional feet. And so casting actually got a pretty bad name for treatment of clubfoot 70s, 80s, and 90s, when Dr. Ponseti kind of developed his technique. And what kind of separates the Ponseti technique from other types is actually the first step, because the big toe is typically down relative to the rest of the foot, and you actually turn the toe up and turn it over. So in many ways, you're actually making the foot look a little bit worse, because you're trying to get rid of what's the cavus, or the high archness. So that's the first step of that casting, is that you kind of bring that big toe up. And then as you're then turning the foot outwards, keeping that big toe up, preventing the foot from becoming, from the high arch. And so the Ponseti method is a series of casting. You typically 4 to 7 casts kind of done on a weekly basis. To correct the foot. And whether it's 4 or 7, all depends on the flexibility of the foot, but about 90+% of club feet will fall within that 4 to 7 range. And once the foot is corrected, so the foot's turned out, so we correct the hindfoot varus, the cavus, and the forefoot adductus, so the turning in, then we assess the heel cord. And so the heel cord, or ankle equinus, the Achilles tendon is tight in clubfoot. And in my practice, about 80 to 85% of club feet, once the foot is corrected, has residual hindfoot equinus. And that actually, at that point, we then discuss what's called a heel cord tenotomy or Achilles tenotomy. And that's a small procedure done in the operating room, where we're actually cut the Achilles tendon completely. Now it sounds kind of crazy that we're cutting a tendon completely, but kids are pretty amazing. Up until about age 2, if you cut the Achilles tendon completely, bring the ankle in a up position and cast it there for 3 weeks, amazingly, babies will reform their Achilles tendon in those 3 weeks, but it's now at the correct length. So for you or I, that wouldn't work, but for the magic babies, that does.
That's amazing. And
it really is incredible that
I think what is amazing to me is that you're able to do all of this without any sort of major surgery or major reconstructive surgery for children. And I think that would appeal to a lot of parents.
And for sure. And so certainly when the kite method got kind of bad rap, that pretty much everyone went through extensive surgery. And we know with those feet that require extensive surgery, there's a lot of stiffness, and it really results not great with extensive surgery. And now that we're seeing the first, the kids in their late teens, now the first ones to go through the Ponseti method, at least here at Shriners, that their outcomes are incredibly great compared to extensive surgery. So other than, so most of the kids who get the more smaller procedure with the Achilles tenotomy, most of them, good 85% of them who need that don't need any more surgeries. Wow. And then after they have that Achilles tenotomy, if they need it, they go into a cast for 3 weeks. And then after that cast, they go into a set of shoes attached to a bar where the feet are turned out, and we use a dynamic bar that allows them to move their ankles, which I think is better tolerated than the prior more static bar. And with that bar, we start out 23 hours per day, and then wean down to such that they're starting to sit up, starting to do more adventures in crawling, to just naps in nighttime, and then naps in nighttime until age 4 for the bracing.
So this is great. You get most of this done before they're even starting to move around and
for sure. And the bracing is an important part, and I think even more important than the bracing is the family stretching. And so after the if they need the Achilles tenotomy or not, just before the braces, our physical therapist will instruct the family here in clinic on that stretching regimen, and that's, I think, if not the most important part of kind of preventing recurrence of the clubfoot.
Which is another reason why you have to have everybody be part of a team, and the family is part of that team as well.
Oh, absolutely. Family is a necessary part of that team.
So one last question, and I think this is a super important one, because sometimes people feel like they need to find, the best in clubfoot care. Why should they choose Shriners Hospitals for Children, and why are we the best in clubfoot care?
Yeah, so certainly I think that with the team atmosphere here, I think Shriners we do a fantastic job taking care of kids with club feet, and take them from birth till they're older teenager, young adult, and really the kind of the continuity of care, and that everything here is in house. All the braces they get are here at Shriners, and we do, again, our goals are for every child is how can we maximize this child's function, and how can we get them, and what can we do to get them there.
Tell me a little bit about how families will feel when they come into Shriners Hospital, and kind of the difference that, kind of sets us apart when you enter into Shriners Hospitals for Children.
Yeah, and certainly, to be greeted at the door. And when we first come in, we will have a visit with kind of our team, including the doctor, and I'll go through and I'll discuss, make the diagnosis of clubfoot, discuss treatment. We have some handouts and workbooks that we can send home. And sometimes the foot is, when we first come in, sometimes the foot is too small to start, meaning that by the time we finish the treatment, the foot wouldn't be big enough into the braces. So sometimes they may come in and not cast that first day, just because I want the foot to be a particular size before we start the casting. Yeah. But at least we can get all the information. And if the foot is the right size to start, we'll start that same day if the family would like.
That's so great. So, Dr. Miller, I just really want to thank you for taking time out of your busy schedule of caring for our patients to help us understand a little bit better about how we take care of children who have clubfoot and other similar conditions. Thank you so much.
Well, thank you, Tammy. It's been a pleasure.
That's all for us today here at Shriners Hospitals for Children in St. Louis, and we are so glad you joined us today. If you'd like to make an appointment for your child to get the most amazing care anywhere, or if you'd like to make a contribution in support of our care of our kids, check out the comment section of this video or find us on the web. Thanks again and have a great day.
Thank you.